Well, May is all about mental health awareness, but today we're talking about a brand new campaign that's being rolled out to bring awareness for Michigan Minds. We have Kathy and Alexandria joining us this afternoon. How are you, ladies?
Very good. Thanks for having us.
Yeah, well, thank you for joining us today. Well, Kathy, you founded Michigan Minds, which I know is something that's pretty close to your heart. But talk to us about what this initiative is.
So we are very much about creating awareness around early psychosis. And psychosis is a varied experience where people can notice changes in their thoughts, in their feelings, and in how they're making sense of their experience. And Michigan Minds, www.michiganminds.org, is our website, and that is a resource hub for youth and young adults ages 15 to 35 who may be experiencing an early episode of psychosis. I also like to mention that it's a resource for people who support those young people too. So that might be a parent, might be another family member, it could be a friend, it could be a teacher, it could be somebody in the faith-based community. So there's resources on the website geared toward young people ages 15 to 35, but also toward people supporting them. And in Michigan, we have adopted a coordinated specialty care model for early psychosis care, and we're using an evidence-based model called Navigate. And what Navigate does is it brings together multiple elements on a single team. So people can get lots of different support on the team. They can get individual therapy support, they can get support for family, they can get support for work and school. There's prescriber support and a shared decision-making approach to medication decisions.
So talk to us about how common psychosis actually is, and why was this something that you specifically wanted to focus on, especially with young children and youth?
It is more common than people think, and I do think we want to say these things out loud.
Yeah.
And it is actually 3 out of every 100 young people will experience psychosis. We really want to reduce the stigma and increase people's awareness to talk about this out loud so that people will be more comfortable reaching out for care. They'll have less hesitancy about connecting to care.
Yeah, and the first way to do that is, like you said, talking about it out loud. Now, Alexandria, you're a peer support specialist, and your role is pretty unique. So talk to us more about what you do.
So with my role, it bridges the gap between formal health care and lived experience. Experiencing psychosis can be very isolating and hard to communicate like what you're going through. I found meeting with like a peer is helpful in that way.
Finding somebody else who shares in that experience with you too really makes that process a lot easier, especially when you're going through treatment, which I know is something that is available. So can you talk to us about what that looks like exactly?
The treatment is holistic in nature. There's a lot of different components to it, like the peer role, the family peer support with medication management. There's also substance use treatment as needed.
There are a lot of different options and different forms of treatment out there, which is really important, especially when we're talking about early detection and treatment. So talk to us about what that looks like too.
Well, we really understand fully now that the earlier somebody gets to care, the better the outcomes, the better the likelihood that they will have a rich and meaningful life. There really is this critical period between 1 and 2 years where getting care in those early days and months of experience can make a huge difference in terms of people taking that step forward and doing the next thing in their lives.
That's right, the sooner the better. But also I do want to mention that insurance is a common barrier that a lot of people do experience. So what should they do if they don't have?
Well, that's an important thing, and ultimately our bottom line is we want to remove barriers to people accessing care. So if there is something that's creating hesitancy or feels like it's getting in the way of getting to care, maybe it's insurance, maybe it's finances, maybe it's some other information you need to make that decision. We really want to have a conversation with people, and we want to put our heads together to solve that and remove that barrier. So we really encourage people to reach out either through the website or through the email link, and we're there to solve those barriers and remove those barriers. So please reach out.
Thank you so much for breaking all this down, Kathy and Alexandria. And of course, if you are interested in getting involved with Michigan Minds, take a look at the bottom of your screen. We have all that information listed below. Plus, we'll have it on WILX website tonight as well. So thank you both so much for joining us today.
Thanks for having us.
Thank you.